So coronary artery disease or coronary heart disease is a condition where the arteries to the heart are diseased and there's reduced blood flow to the heart muscle. It's estimated there's about 16 million Americans who have coronary heart disease. About 9 million have symptomatic disease. In other words, they have angina or have experienced a heart attack. 7 million are asymptomatic. And coronary heart disease actually results in about 1.5 million inpatient heart cath or intervention procedures each year in the United States. The most common form of coronary artery disease is atherosclerosis, where there's atherosclerotic plaquing, where the plaque deposits into the wall of the artery, narrowing the lumen of the artery. Other forms of coronary artery disease include anomalous coronary arteries, where people are actually born with arteries coming off the aorta in different positions, and that can sometimes lead to reduced blood flow to the heart muscle. And finally, a rare form is when you have connective tissue disease or vasculitis, then you can have inflammation of the artery, which reduces blood flow to the heart muscle. The primary risk factors for coronary artery disease include what we call the big five: high blood pressure or hypertension, hyperlipidemia or high cholesterol, diabetes mellitus, cigarette smoking, and family history or genetics. The main symptom of coronary artery disease is angina pectoris, which is a dullness, pressure, or squeezing in the center of the chest, which can radiate to the jaw, the neck, the arm, or the back. It can also be associated with shortness of breath, or diaphoresis, or sweating, or nausea. There are also other forms of angina pectoris where you may only experience discomfort in your jaw or on your arm, or just being short of breath or sweating. Coronary artery disease is diagnosed with a physician looking at a patient in kind of a multi-pronged approach. We use the clinical symptoms, the description of the discomfort, the risk factors, how many risk factors are present. We also use the physical exam to help determine if we think coronary heart disease is present. Additionally, we also look at EKG, sometimes blood work to see if the cardiac enzymes are elevated. And finally, there's different types of imaging of the heart, such as an echocardiogram, a stress test, or a nuclear test. Treatment options for CAD includes kind of the heart-healthy living, where a patient will eat an appropriate diet, try to keep their cholesterol low, try to get regular exercise, and maintain a normal weight. Medications include aspirin or the antiplatelet medicines such as Plavix, Brilinta, or Effient. Other forms include beta blockers, nitrates, cholesterol medications as well. And beyond that, if an intervention is needed, we do balloons and stents to open up the artery. And bypass surgery is also another way to treat blocked arteries.